My name is Jackie Brereton. By profession, I'm a respiratory specialist nurse. I've had the privilege to work in respiratory medicine now for over 30 years in looking after both adults and children. My speciality has been the care of children. I've recently been involved in a project called Little Lungs, who are part of Koala, a charity based on the Wirral, who offers support to parents, to healthcare workers, schools, anybody that needs some health and advice on all different types of conditions, of health conditions, so not just respiratory. However, excuse me, this grant that they were given was literally focusing on RSV, because really we wanted to try and explain a little bit more about it. So I am here today not as Healthier South Wirral PCN, but on behalf of Koala for Little Lungs. I'm going to put that scientific slide up just to sort of show you how complicated RSV is, because really when we think about it, RSV is just the good old common cold that can develop into a lot more. It is a respiratory virus, respiratory syncytial virus, I can never quite say that, and it can affect all parts of the airways. Normally, as just that everyday good old common cold, it is the upper respiratory tract infection, but can develop into the lower respiratory tract infection and give us more, as such as bronchiolitis or even pneumonia. And when we get as far as bronchiolitis and pneumonia, it can be much more, a baby can be much more symptomatic. A little bit of science there. We know there is two antigenic subgroups, A and B, and we know the RSV genome encodes into 11 different proteins. So you can just see how it breaks down, and we can understand a little bit more about it. And I think our science is changing as well now to understand a little bit more about it since we've had coronavirus. Because if you break down the RSV, you will see a strand of coronavirus there, which we know we've had in the cold for many, many years. But of course, we've just seen it more recently in a different mutation that's actually caused us so many devastating effects. So what about RSV, the disease background? Well, we know a cold RSV is highly contagious, and the disease burden is different age groups, but it's most common in babies and little toddlers. It is spread by contact, by droplets from the nose or throat by the infected person. And of course, it can leave a contamination on surfaces and objects, just like you can with coronavirus as well, very similar. RSV can survive for several hours on these surfaces and objects, particularly such as a stethoscope. That's why it's so vitally important that doctors and nurses do clean their stethoscopes when they have examined a baby or a child, or even an adult after they've been in surgery or hit clinic or in hospital. And it can stay there for at least 30 minutes on our hands. One of the best methods of testing for RSV is the good old PCR, which of course is what we've been doing now on a regular basis. Now, we don't routinely check PCR in general practice in England. However, in America, they do. And most recently, I had hands-on effect with RSV with a 3-year-old, my grandson, who was incredibly poorly, but thankfully didn't need hospital admission. But he was confirmed to have RSV within 30 minutes in his general practice. To me, this was brilliant because we knew what we were treating. And in fact, it is a reassurance because, as I will mention in a moment, the treatment for RSV is a little bit, at times you actually want a treatment and there is no treatment for RSV, but I'll go into that in more depth. So it was reassuring that we didn't need to worry about a treatment, but also to keep an eye on him. But knowing there was a confirmation of RSV gave us that help. In children, one of the most major causes of respiratory illness and infections is the infant with RSV under 1, but nearly all children under 2 become infected at some point. In healthy young adults, RSV infection is generally associated with just the common cold. But of course, that can be then transferred to a younger baby that can develop more. In older adults or anybody that's immunocompromised may find that the infection may develop into more a severe disease and may need hospitalization. If you think of COVID and social distancing, we think it's actually more or less flattened the curve for RSV, because due to effective social distancing in 2020, in the spring of 2021, we saw a huge decline. And that was because obviously the social distancing, we were wearing face masks, the lockdowns, and we just didn't see flu and actual RSV. So therefore, has that actually changed the shift, the peak? Has it changed our season? We've always believed RSV is from the 1st of October or thereabouts until the end of March. That's our main season. But of course, for the first time, I saw it in a young baby of 5 weeks in July of last year. And I've never seen it that early before in all my experience of respiratory medicine. So are our parameters changing? As I've previously mentioned, it is a cold. However, the symptoms can deteriorate rapidly. And in a young baby, a young toddler, they can actually change very quickly within hours. So what do you look out for? Well, when a young baby or child is unwell, it can rebound on the whole family. Parents want a treatment. Antibiotics do not work in RSV. It's often the case of just riding the symptoms out, which can be extremely exhausting for the child, but it can also be exhausting for the family, especially if you've got more than one baby or more than one child. Cough can be the main symptom, and that cough can go on and on and on. And it wakes up everybody, and everybody becomes totally exhausted. So other symptoms to look for is obviously the cough that we've mentioned, which can be extremely frightening for the baby or the child, but also for the parents, because sometimes they can't get their breath. They may be gasping. The baby or child may sound phlegmy. That phlegm is stuck there and it just can't come up. The runny nose, often constantly dripping, constantly wiping up the nose. And don't forget, use a tissue and put that tissue straight into the bin. How often do we put a tissue up our sleeve or put it on a table? We are just transmitting those bugs. If they have a mild temperature, if you have a thermometer, that's the best way. But of course, if not, then put your hand on their chest. Don't put it on their forehead where it will be cold blood. Put it onto the chest and you'll get a better idea of how warm they are. So what can you do? Well, keep a regular eye on your baby or child. Don't worry about giving large feeds or meals. Think of smaller ones on a more regular basis. It may be they want just a nourishing drink or something light. If they actually do have a persistent cough and that cough actually tugs into them, they sometimes can then start to feel quite sickly. So it's actually better to give something lighter and more regularly. However, fluid intake is more important. Do make sure that your baby or child remains very hydrated. After they've had a meal or a feed, it's better to sit them up rather than lie them down, because you know yourself, if you actually lie down after a large meal, particularly at night, you can get gastric reflux. So therefore you can get this reflux action just the same, which can trigger the cough. One of the most vitally important things you can do to keep your baby or child safe is to wash your hands and disinfect the surface, remembering what I said previously of how these germs can last on surfaces for at least 30 minutes. And if you're a smoker, perhaps now is the time to quit. Just think of that smoking. It will actually make any respiratory disease much worse. So the cough will increase, their poor breathing pattern could increase. So it's really important to think about not smoking anywhere near them, not even in the same building if possible. Go in the garden, but try and quit. So how do you manage RSV? Well, as I said before, there is no known treatment. So antibiotics or steroids won't help your baby or child. However, if they are on antibiotics or inhalers for another condition, such as cystic fibrosis, asthma, or anything like that, please do not stop that line of treatment. They are not being given for RSV. They are being given for something else. So seek medical advice if you are having difficulty getting that medication in. If your baby or child has a fever, then give them paracetamol on a regular basis. However, if you're not sure about that, speak to your local pharmacist or your doctor's surgery. Keep your baby or child at home if possible. RSV is very contagious and it will spread. RSV can return. You might just think you've got rid of it and it's all settled and it's all gone. But unfortunately, the symptoms can return. And this can happen for anything up to 6-7 months, whereas the symptoms can just come back out of the blue. Don't forget, if your child needs some extra support, seek some medical help. If you have a child with special needs or a special condition, then don't be alone. Don't worry about this. Seek some help and advice. Don't be frightened to ask. So when does it become bronchiolitis? Normally RSV can be managed at home. Actually, however, if the case actually gets worse, so more of the airways are involved, particularly the smaller airways, and the virus has travelled, maybe pneumonia, then you will have to take that child to hospital for advice. You may find they can deteriorate very rapidly, and I mean within hours, so don't leave it. Keep an eye on that baby or child. This can be more noticeable in premature babies, 6 weeks and under, and obviously children with more complex health conditions. When to seek help? Well, don't forget, there's little things you can look for. So a baby, a child is finding it harder to breathe. Look at how they're breathing. Look at, is their tummy tugging in? Paler skin, is it not paler than normal? Fewer wet nappies than normal. Not taking fluids, decreased feeding, vomiting, a high temperature. Look at what their temperature is. If you don't have a thermometer and their chest feels very hot, then do seek some advice. If you've got any concerns they're getting worse, then call 999 or go to A&E. However, if your baby or child is having difficulty in breathing, do not take the child and driving them to A&E. Call 999 first for advice. If you just want to talk to somebody, this is what Little Lungs is all about. As I mentioned before, it is a support group that has been developed through Koala, through a grant. It's been available since October 2021, and it will be there until the end of March 2022. No question is too silly. They have some great support group meetings. I tend to join those meetings with parents, carers, grandmas, grannies, grandpas, anybody that just wants to seek some additional advice. They are there for you and your family. So please don't be afraid to ask. This is some details, and they've got a fantastic little leaflet that you can get online, or also you can get it from your GP practice. You should see some leaflets out there, or ask one of the receptionists. This is there to help you, so don't be frightened to ask.